A very good evening to all of you. I'm Sayukta from Bladder Wellness Team. I'm sure all of you must be keeping good health. Please vaccinate yourself and do wear masks when at public places. Hematuria is a common clinical feature in prostatic disease like BPH and prostate cancer, and hematuria due to BPH. Clinical presentation with a community prevalence of 1 in 40 patients and is estimated to count for 4 to 20% of all urological hospital visits. BPH is a very common problem that affects the quality of life in approximately one third of men older than 50 years worldwide. Approximately 13 million men have symptoms related to BPH. In this week, let's unite to raise awareness about hematuria due to BPH and its impact on the life of people living with it. To throw more light on the subject and guide us on what's right for diagnosis and treatment of hematuria due to BPH, today we have with us Dr. Naresh Sapariya. Dr. Naresh is Senior Consultant Neurosurgeon from Gokul Hospital, Rajkot. Dr. Naresh is having rich experience in the field of urology and carries out the treatments with utmost precision and efficiency, ensuring that patients' health is in safe hands. A very warm welcome to you, Dr. Naresh. Hope you are doing good, sir.
Yeah, thank you. Good evening to everyone.
डॉक्टर नरेश, आज हम बात करेंगे कि हिम्यूट्यूरिया क्या है, क्यों होता है और कैसे इससे हम बचें और ट्रीटमेंट क्या है। लेकिन सबसे पहले हम जानना चाहेंगे आखिर ये होता क्या है।
हिम्यूट्यूरिया यानी इट इज ब्लड इन यूरिन, लेमन लैंग्वेज में यानी पेशाब में खून आना। ये इसमें ऐसा होता है कि पेशाब पेशेंट को कई बार ऐसा होता है कि कंटिन्यूस हिम्यूट्यूरिया कंटिन्यूस पेशाब में ब्लड आता है। कई बार ऐसा होता है कि 2 दिन आता है, 2 दिन नहीं आता है। यानी there are different types of hematuria, but basically it is hematuria that means blood in urine.
ओके, सो ब्रॉडली हमें समझना चाहिए कि ब्लड इन यूरिन है तो या यूरिन में ब्लड है तो वो हेमेटूरिया हो सकता है। तो ऐसे में डॉक्टर आपसे जानना चाहेंगे कि व्हाट आर द मेन कॉजेस, आखिर क्यों हेमेटूरिया होता है?
There are many causes. Hematuria, we should not take hematuria as lightly as people think. It is because there can be a major cause. Basically, hematuria can be of many causes, like stone disease. It can be in bladder stone. It can be in kidney stone, urinary stone. It can be due to the BPH, as you said. That is due to the prostatic enlargement, which most commonly occurs in old age person. That is common after 50 years. Other causes includes bladder growth. That is very devastating disease. It should not be taken as lightly as people think, because bladder growth is most in 90% cases it is bladder cancer. So in bladder cancer also it leads to hematuria. Other causes includes like prostate cancer. In advanced stages, when prostate has progressed in advanced stages, there is increased size in prostate, which causes obstruction in the urethra and leading to along with part of cancer, it leads to hematuria. And in some cases it may also due to urethritis, that is infection of urethra. It can also lead to this hematuria.
Right. So, doctor, most of the causes that you just stated is related to prostate, which is an organ which is present in men,
Yes.
like you said, BPH or prostate cancer, etc. But you also mentioned that due to infection of urethra, hematuria can also happen. Now, my question is कि क्या ये सिर्फ पुरुषों में ही होता है क्योंकि प्रोस्टेट इसका एक बड़ा रीजन है, या महिलाओं में या सब में ही ये हो सकता है?
नहीं, it can happen in both sexes because as we know that prostate is only present in male, but in female also due to bladder stone, bladder malignancy, renal stone disease, renal malignancy, these all lead to hematuria in both sexes. And other thing that in female also due to UTI, we commonly say UTI, that is due to cystitis and pyelonephritis can also lead to this hematuria thing.
Right. And you said that, hematuria can also be caused by BPH. Now, I want to know how common is that, because BPH is a very common condition with men after a certain age. So how common is hematuria caused by BPH?
Yeah, it's very common. As we can see, one in third to 4% we can see hematuria with BPH. Actually, the prostate, the thing is the prostate is present in only male. It increases in size after 50 years. That in after 50 years it gradually increase. In some patients, it's increased drastically. In some patients, size increases slowly. So it's variable. It's not fixed. But symptoms can be variable also. It doesn't correlate with the size of prostate. Some patient may have 100 gram of prostate, but it doesn't have any symptoms. Suddenly present with acute retention of urine. And some patient may have only 20 to 25 gram of prostate, and they have severe symptoms, which we commonly say lower urinary tract symptoms like frequency, urgency, nocturia, burning micturition, intermittency, all these symptoms. And patient, when the size generally increases more, then they have more chances of hematuria. Why? Because the increase in size causes obstruction in urethra. So patient tries to avoid with straining. And during strain, the prostatic vessel gets rupture, and it will lead to hematuria. So basically, BPH, as we see, it is quite common due to hematuria due to BPH, like 1 in 3 to 4%.
Is hematuria an emergency condition? We need to go to the hospital immediately?
Yeah, we should. Any hematuria should be evaluated, diagnosed, and treated. Any hematuria. Even one episode of hematuria should be properly consulted, diagnosed, and treated, because it can have underlying disease, like as I said, malignancy. BPH can be managed. BPH stone can be managed with intervention, but this malignancy, renal malignancy, kidney malignancy, bladder malignancy, prostate malignancy, it needs a lot of investigation, treatment, and further follow-up. That's why every hematuria, even a single episode, I would say must be consulted, diagnosed, and treated.
Right. So even if it's the first time that anybody is experiencing blood during urination, it should not be ignored. Please go and consult a urologist, urosurgeon as soon as possible. Now, another question is the doctor, is it curable?
Yeah, it is curable. It doesn't mean that if the underlying condition is cancer, then it cannot be treated. This is hematuria is just a symptoms. Right. So what we said is blood in urine. So it can be treated. It is definitely treated. Underlying cause is diagnosed, investigated, diagnosed, and according to the cause, we can go for the treatment. Like if there is the bladder stone, we can go for the surgery of bladder stone. If there is renal stone in the pelvis or any calicial stone, it can be treated with surgery. Or any radio frequency ablation or any other modality. So it definitely can be treated. It is not that it cannot be treated.
Okay, so the bottom line is that it is treatable, it's curable. So nothing to worry, don't panic if you see blood while urination. You just need to go and consult a doctor. That's very important. Don't ignore it, even if it has happened for the very first time.
Yes.
The doctor, the thing is, you said that many things are associated, like it can be due to BPH, it can be due to malignancy,
Yes.
cancer in the prostate, or due to UTIs, etc., etc. क्या ये भी एक संभावना है कि अगर बहुत पहले ही हमें सिम्टम्स मिलते हैं, लाइक जैसा हम बार बार बोल रहे हैं यूटीआई महिलाओं में बहुत कॉमन है, किसी में भी हो सकता है लेकिन महिलाओं में बहुत कॉमन है, उसके एक सर्टेन सिम्टम्स हैं. BPH again is very common after a certain age in men. दूसरे भी जो प्रॉब्लम्स है एज रिलेटेड, द सिम्टम्स आर देयर, ओवरएक्टिव ब्लैडर इज देयर, द सिम्टम्स आर देयर. अगर इन सिम्टम्स को हम कंटिन्यूअसली बहुत लंबे समय तक इग्नोर करते रहेंगे तो हेमेट्यूरिया की नौबत आ जाती है.
I wouldn't say overactive bladder will lead to the hematuria, but overactive bladder patients have sometimes it have tendency to strain. That can lead to hematuria in the advanced stage, not in early stage. Overactive patients generally have symptoms like increased frequency, urgency, sometimes burning micturition. They have all these things, but hematuria is not that quite common in overactive bladder. but it can lead if it is associated with other things like as I said, cystitis, stone disease, or if it associated with a patient like BPH can also have overactive bladder, then it can have hematuria if there is associated symptoms plus straining.
And how can we prevent hematuria? We always say that prevention is better than cure. तो क्या कोई ऐसा तरीका है कि हमें कभी हेमेट्यूरिया हो ही ना, हम उसे प्रिवेंट कर सके?
Yeah, we can say actually we need to see whether the anything hematuria thing is checked. It is there is underlying cause, so we need to I would say aware about the that lead to hematuria, like stone disease, like cancer. Right, so we need to have increase a bit of water, like 2.5 liter of water should be taken daily. So there won't be hematuria due to the stone disease. Daily intake of 2 to 2.5 liter urine water will increase the urine, and there will be less chance of stone formation. So if there is no stone, there won't be hematuria. Same thing is malignancy and cancer. Like in urological malignancy, I would say smoking has a more prevalent role. Like it will cause kidney cancer, it will cause bladder cancer, it will cause prostate cancer. So smoking should be avoided. Other things, tobacco should be avoided. Obesity should not be that much. I would say morbid obesity will also increase the risk of malignancy. Right? Other things, I would say hypertension. Hypertension can also lead to this malignancy, and it should be within well controlled with medicines. Other things I would like to mention here that some patient is on antiplatelet medications. Like we said, some may have undergone angioplasty, some may have undergone bypass surgery. So these patients are put on antiplatelet and anticoagulant medication for lifetime. Even these patients have increased risk of hematuria. So they should be regularly in patient. This patient should be in regular follow-up of their doctors to prevent such things.
Right. So it's important to keep ourselves healthy so that we can prevent the occurrence of hematuria. Now, doctor, another question is, as you said, कि अगर stone होंगे तो हो सकता है बाद में जाके हेमेट्यूरिया हो, BPH या कैंसरस प्रोस्टेट की वजह से भी हो सकता है. अगर चूंकि हम कई बार ये भी कहते हैं कि एनुअल एक चेकअप होना बॉडी का बहुत जरूरी है और एक एज के बाद तो वो डेफिनेटली करते ही रहना चाहिए हर साल. तो हो सकता है कि हम अगर पहले ही इन सब प्रॉब्लम्स को समझ ले, एड्रेस कर ले तो इसकी नौबत ही ना आए.
Yeah, surely you said it right. Definitely, I would suggest every person above the age of 50 years should have annual checkup, including blood reports, urine, sonography. The basic investigation should be done to rule out any causes which will lead to hematuria in future. That can be easily diagnosed. The other stone disease, malignancy, cancer, that can be easily diagnosed by investigations. So we can prevent them. Yes, definitely, sure.
Whenever we think or say that we are having or experiencing blood with urine, that itself is very scary. बहुत से लोग तो यूरिन में ब्लड देखकर ही मान लेते हैं कि ओह मुझे तो कैंसर हो गया, मैं ज्यादा दिन नहीं रहूंगा. तो इस तरह की बातें हमारे दिमाग में इतनी बसी हुई है, हम इतना डर जाते हैं खुद से ही, क्योंकि हम बाहर आके किसी से ये डिस्कस ही नहीं करते कि ये प्रॉब्लम है और हो सकता है इसका इलाज है. आपने बताया कि ये क्योरेबल है और इसके लिए हमें सिम्टम्स को बिल्कुल भी इग्नोर नहीं करना चाहिए. तो वो हमारे तमाम दर्शक जो अभी तक इस सिचुएशन को बहुत ही स्कैरी समझ के बैठे हैं, किसी से डिस्कस नहीं कर रहे हैं, उनसे आप क्या कहना चाहेंगे?
मैं ये कहना चाहूंगा कि इससे डरने की जरूरत नहीं है. ये ऐसा नहीं है कि भाई एक बार हो गया तो कभी ट्रीट नहीं हो सकता. इसको डॉक्टर को कंसल्ट करना चाहिए. डॉक्टर अपने हिसाब से जो भी इन्वेस्टिगेशन करे, रिपोर्ट करे, वो करवा देने चाहिए. डायग्नोसिस करना चाहिए. हमें कॉज तक पहुंचना है कि इसका हमेचुरिया का कॉज क्या है. भले ही हमारे सब रिपोर्ट्स नॉर्मल आए, लेकिन हमें तो ऐसा हो जाए कि चलो हमेचुरिया हुआ, इसका एटलीस्ट हमारा कोई कारण नहीं है. तो चलो, कई बार ऐसा भी होता है कि कई बार हमेचुरिया के 1-2 एपिसोड होते हैं तो कोई कारण नहीं मिलता है. कई बार ऐसा भी हो सकता है. इसमें इडियोपैथिक हमेचुरिया जिसको हम बोलते हैं, जिसका कोई कारण नहीं होता है. ऐसा हो सकता है, लेकिन इसको हमें थॉरली इन्वेस्टिगेट करना चाहिए ताकि हमें पता चले कि भाई अंदर कोई अंडरलाइन कोई कोज नहीं है, ये हेमेचुरिया हुआ इसका कारण है कि नहीं है। अगर कारण मिल रहा है तो हमें उसके मुताबिक आगे बढ़ना चाहिए, उसके मुताबिक ट्रीटमेंट करवाना चाहिए। अगर कारण नहीं मिल रहा है तो हमारी मन में भी शांति रहती है कि चलो कोई कारण नहीं है, ये जो भी हुआ है ऐसे एक बार एपिसोड हुआ है ऐसा। दूसरी बात ये है कि even in India we commonly see patients from periphery came with complaint of hematuria since 2 months, 3 months, and we initially when we investigate them we came to know that the hemoglobin level is 4, hemoglobin level is 3. The condition should not be reached at that level. यहाँ तक इतनी राह नहीं देखनी चाहिए, जितना जल्दी हो सके उतना ही हमें डॉक्टर को कांटेक्ट करके जितना जल्दी हो सके उतना ट्रीटमेंट करवाना चाहिए, क्योंकि ये फिर एक ऐसी कंडीशन आ जाती है कई बार हीमोग्लोबिन 3-4 हो जाता है तो फिर हमें ब्लड चढ़ाना पड़ता है, ब्लड की सब वो सब प्रोसीजर करनी पड़ती है, ट्रांसफ्यूजन अननेसेसरी ट्रांसफ्यूजन ऑब्वियसली अवॉइड करना चाहिए, लेकिन ऐसी कंडीशन हमें देना ही पड़ता है, ऐसा होता है। पर्टिकुलर इन फीमेल, इंडिया में क्या है कि फीमेल लोग ज्यादा अपनी कंप्लेन एक्सप्रेस नहीं कर पा सकते हैं, तो इसकी वजह से फीमेल में भी ऐसा होता है कि हम कॉमनली देखते हैं कि फीमेल पेशेंट आती है तो इमेच्योर की कंप्लेन होती है, तब पता चलता है कि भाई उसको अंदर स्टोन डिजीज है, उसको तो 1 साल पहले भी इमेच्योर हुआ था, अभी 2-3 महीने से इमेच्योर हुआ, लेकिन अपनी कंप्लेन उसने कभी किसी को बताई नहीं, फिर कंडीशन अल्टीमेटली जो कंडीशन में आती है वो फिर सीरियस कंडीशन में आती है, ऐसा भी हो सकता है कई बार, इसलिए।
So the bottom line is that please don't ignore the symptom. If you are experiencing blood while urinating, take it seriously, go and consult your doctor. हो सकता है कंडीशन सीरियस ना हो सकता है बहुत अर्ली ही डिटेक्ट कर लें तो आपका ट्रीटमेंट बहुत आसान हो, बहुत जल्दी हो जाए, लेकिन इसे इग्नोर करते रहेंगे तो डेफिनेटली वो हमारे हेल्थ के लिए बहुत हार्मफुल हो सकता है। डॉक्टर, मैं ये भी जानना चाहती हूँ, हमने कहा कि बीपीएच की वजह से होना हेमेटूरिया बहुत कॉमन है, तो ऐसे में बीपीएच ट्रीट करना कितना इजी है, क्योंकि आपने कहा कि रूट कॉज है उसे ट्रीट करना सबसे ज्यादा जरूरी हो जाता है, तो वो कितना इजीली ट्रीट हो सकता है बीपीएच?
एक्चुअली इन बीपीएच वी और गाइडलाइंस इन यूरोलॉजी, actually not every BPH is needs to be operated, right? There are certain indications which require surgery, otherwise BPH can be managed by medicine also. So when there are 6 to 7 indications, like one of them is hematuria. When there is hematuria, episode of hematuria, which is recurrent and intractable, that cannot be managed with IV fluid, blood transfusion, or even with intravesical medicines, then it needs surgery for the BPH.
Okay.
Because the thing is, hematuria and BPH is quite common due to the straining, as I said, due to the straining, because there are lobes of prostate. There is 2 lateral lobes, 1 medial lobe, and other is a posterior lobe also, including central lobe also. So it's the main cause is medial lobe and lateral lobe. When there is increase in size, the lateral lobe will come into the way of urethra. Along with when there is increase in size of medial lobe, it will increase in intravesical, that is bladder में बढ़ता है, जो बोलते हैं कि bladder में भी prostate बढ़ती है, intravesical prostatic protrusion. So while urinating, patient will strain due to increase the stream or to pass urine, and that will cause rupture of the vessel, and that will cause hematuria. So as I said, intractable recurrent hematuria due to BPH must be treated, and it need most commonly it needs surgery.
राइट, तो ये तो बात हुई बीपीएच की, या जैसे हम बहुत आम भाषा में प्रोस्टेट एनलार्जमेंट कहते हैं उसकी। लेकिन अगर वो मैलिग्नेंट हुआ, अगर वो बेनाइन नहीं है, यानी कैंसर हुआ प्रोस्टेट का, तो भी क्या वो ट्रीटेबल है?
Yes, definitely. Actually, whenever patient comes with the complaints of symptoms of BPH, we also look at the part of prostate cancer. We thoroughly examine the patient. We do digital rectal examination, which will give us idea about whether there is if prostate is firm, there is less likely to be to have prostate cancer. If its prostate is very hard, it is very enlarged in size, then there is high chances patient may have prostate cancer. So along with, we also do PSA, that is prostate specific antigen report, which will also guide us whether patient is having BPH or prostate cancer. Generally, in case of prostate cancer, it is highly enlarged, very enlarged. PSA is very raised. Plus, examination also gives us idea but there is also some dilemma when the PSA report is normally we believe is up to 4 nanogram per DL we believe is normal, but when it is between 4 to 10 there is dilemma whether we should go for the investigation of prostate cancer or whether we should go for direct for the BPH surgery. Then we can have option nowadays. We can have option of NPMRI, that is MRI prostate, which will give us about idea. And it also suggests that there is high chances of prostate malignancy, prostate cancer. Then we will go for the prostatic biopsy, that is histopathological examination, which will 100% give us diagnosis of BPH or malignancy. And if we found on biopsy there is prostate cancer, then we will go for the management of prostate cancer. And hematuria due to prostate cancer can definitely be treatable.
Okay, so prostate cancer again is treatable. So nothing to worry, nothing to be scared of. You just need to consult your doctor if you have blood while you are urinating. So if you have this condition, please go and consult your doctor. That's really important. I would also like to know, doctor, that, how can we actually, suppose a person is there who is experiencing blood in urine, what he or she should do?
Any patient or any person, if he or she having blood in urine, first he should first go to the doctor. He should thoroughly he or she should be thoroughly investigation, basic investigation तो करवाने ही करवाने हैं, जैसे कि hemoglobin कितना है, किडनी का रिपोर्ट कितना है, यूरिन, हेमेचुरिया में एक दूसरी बात मैं ये बोलना भी चाहूँगा, हेमेचुरिया जो होते हैं कई बार अब ऐसे भी होते हैं कि ग्रोस हेमेचुरिया और माइक्रोस्कोपिक हेमेचुरिया. कई बार ऐसा भी होता है ग्रोस हेमेचुरिया यानी कि हमें दिख ही रहा है कि पेशाब लाल कलर का पेशाब आ रहा है, जो हम बोल रहे थे लेमन लैंग्वेज बोले कि पेशाब लाल कलर का पेशाब आ रहा है तो ग्रोस हेमेचुरिया है. लेकिन कई बार माइक्रोस्कोपिक हेमेचुरिया भी होता है, उसको क्या है कि कलर नहीं हो, चेंज नहीं होता यूरिन का, बट व्हेन वी गो फॉर यूरिन रूटीन माइक्रो, in urine report we see there is 40 to 50 RBCs, 60 to 80 RBCs that is present only in urine routine microscopic examination, that is microscopic hematuria. Any hematuria, whether microscopic or gross hematuria, should be thoroughly investigated.
तो जो लैब टेस्ट आप बता रहे हैं, ये ऑफ कोर्स जब हम डॉक्टर को कंसल्ट करेंगे तो वो हमें सजेस्ट करेंगे आफ्टर व्हाटएवर इन्वेस्टिगेशन और हिस्ट्री इन्वेस्टिगेशन दे डू कि हमें क्या-क्या लैब टेस्ट करने हैं.
Yeah, sure. And basic में तो as I said CBC, kidney creatinine report, then urine routine micro, the urine investigation, and USG abdomen pills. These are basic investigation. And if we find anything in this report, then we will need to undergo cystoscopy, CT scan of abdomen pelvis, cystoscopy, and urine cytometry. Yeah.
Okay, doctor, we'll also pick some of our viewers' question. Rajat Saxena is here asking, can enlarged prostate raise PSA? And we would also like to know what PSA means.
PSA means prostate specific antigen. It is increased more in many conditions like prostatitis, BPH, recent catheterization, or prostate infection, as I said, prostatitis, as I said, and any recent digital rectal examination, and prostate cancer. But raised PSA doesn't mean always there is prostate cancer. It depends on the value of PSA. Yeah, and yes, BPH can increase PSA, but that is not that high that we see in prostate cancer. Like in BPH, if size is around, let's say size is 80 to 100 gram of prostate size, that then can be increased in PSA, but it is not that much high that we see in prostate cancer.
Right. We have Sonia. We have Yash Mehra who's asking, at what size of prostate requires surgery?
There is actually no specific size which will define surgery. It is symptoms and complications which will decide the surgery. Normally, prostate size is 15 to 20 gram, and after 50 years, as I said, it increases in size. Then, when initially patient present with BPH and is having symptoms of, as I said, frequency, urgency, nocturia, intermittency, straining, we will put him in medicine. And if even after medication, his symptoms are not relieved, then we will think of surgery. But as I said, there is no correlation between size and symptoms, and as there is no indication for size to go for surgery. Yeah, BPH can have complication like as I said, intractable hematuria, bladder stone formation. When then there is recurrent retention of urine, then a patient may have bladder diverticulum, along with patient may have acute kidney injury due to the chronic retention. These all things will need surgery. Yeah.
Right. So yes, you have your answer, I'm sure. So it's even if the name says enlarged, it doesn't depend on the size or volume. It depends on the complications or conditions, etc., which your doctor will know about. So please go and check with your doctor and trust your doctor. That's really important. We have Akash Singh with us, who's asking, does this treatment option require catheterization after the procedure? Doctor, are you here with us? Can you hear us? We'd like to check and see whether there is a network glitch or we have a doctor with us. I'm sure he'll join us back soon. So we are basically talking about hematuria, a condition where we experience blood while we urinate. The bottom line is that don't be scared, don't panic. It is a condition and it is a curable, treatable condition. The treatment is there. The only thing important is that we need to go and check with the doctor as soon as we see blood in our urine. So please don't ignore it. Don't say that, okay, it's just for the first time. I'll wait and see whether, I'll have it again or not. So don't wait. Just go and check with your doctor. That's really important in case you are having hematuria. Hematuria, there are a number of causes. One big cause is definitely prostate, BPH or malignant prostate or UTIs, etc. So Dr. Naresh is back with us. Yes, doctor. Doctor, we were talking about a question that Akash Singh has raised. He's
Hello.
asking, yes, am I audible to you, doctor?
Yeah. Sorry for the interruption. I somehow got disconnected.
That's okay. That's okay. We completely understand. It's a technical glitch. So Akash is asking, does this treatment option require catheterization after the procedure?
Sorry, which type of interventions?
He's asking, does this treatment option, I'm sure he's asking about in case you are treating hematuria and going for a surgery, etc. Does we need catheterization?
Yeah, surely it does require. Actually, most commonly patient who have hematuria, he has also associated clots. What happens? The patient gets urine voids every 4 to 6 hours. So by that time, whatever blood collects in bladder, it gets clotted. So when patient voids, he have hematuria plus he or she also passes blood clots. So these blood clots may cause acute retention of urine. So in this condition, patient may require catheterization also, and he may also require blood clot evacuation, bladder clot evacuation. So whatever the clots are happening in bladder, then they needs to be evacuated first, and then we have to look for the cause. And yes, it's asking for the any surgery requiring BPH also needs catheterization. Yes, first some patient present with acute retention of urine, and when we go for the investigation, we found that he is having BPH. So BPH can lead to acute retention of urine, and to relieve this retention of urine, we first catheterize the patient, and after investigation and after giving one voiding trial, after removing catheter, it doesn't void, then he needs to undergo surgery. Other thing, when we go for surgery, we generally keep catheter post surgery, that means after surgery for 3 to 5 days, and then we remove surgery after BPH surgery. We remove catheter after 3rd or 4th, 5th day, and then we look for the patient's voiding, patient's stream, patient post-void residue, that is after voiding, how much volume of urine is retaining in the urine.
Right. Fair enough. So, Akash, you have your answer now. Sonia Iyer is asking, is BPH completely curable? It is, can it be cured permanently?
Hello?
Yes, doctor,
Yeah.
the question, question is asked by Sonia. She is asking, can BPH be cured permanently? Doctor, are you able to hear me? I think there is another network glitch, and we are hoping
Hello?
that. Yes, doctor.
Yes,
Am I
yes,
audible
sorry.
to you?
Yeah, sorry. Yeah.
No, it's okay. So Sonia is asking, can
Yes.
BPH be cured permanently?
Yes, it can be cured. I wouldn't say permanently, but it can be definitely cured. It is not like that. For the BPH, we remove whole prostate. For BPH, what we do in surgery, like as we commonly hear the name of TURP, or open prostate surgery. In this surgery, we only remove the obstructing part of BPH of prostate, that is medial lobe and lateral lobe. We don't remove entire prostate. It doesn't need to be removed at all for the cure of BPH. In case of prostate cancer, we need to remove entire prostate. Yeah, sure. But in BPH, there is no need to remove entire prostate. We generally only remove lateral lobe and medial lobe, and then patient generally in 95 to 98% patient, it doesn't require further any treatment.
Fair enough. We have Ankur Nema with us, who is asking, is TURP, TURP surgery, safe, and how it works?
It is surely the safest surgery, I would say. It is quite common nowadays. And
what is it actually, doctor?
It is transurethral resection of prostate. That is, by the per urethral, we pass a endoscope, and we commonly say in our language दूरबीन. दूरबीन से ऑपरेशन जो करते हैं prostate का, उसको TURP बोलते हैं. It is transurethral resection of prostate by endoscope. We pass endoscope. First, we evaluate the urethra. First, we evaluate the prostate size, prostate lobes. We go inside bladder. We see the bladder wall, our uteric opening, and then we go for the surgery, where we chip by chip we remove the enlarged prostate, and then ultimately we evacuate all the chips and put around 20 to 25 two French catheter for 3 days, 3 to 5 days, and we remove after 3 to 5 days catheter, and patient works well after surgery. It is quite common surgery, commonly done by surgeons and neurosurgeons, and there is hardly any complication. Yeah, it can any surgery can have complication. It does have complication, but that is not that devastating.
Okay, so it's the safest surgery, as doctor just said. We have Samar Sen, who's asking, what does initial hematuria mean?
There are types of hematuria. As I said, gross and microscopic. Other classification is initial, total, terminal. Initial means when we go for the urination, there is a drop of blood, there is red urine initially in the starting phase of urination. Then the urine gets clear. That is initial hematuria. In terminal hematuria, we works well until the last moment. Then comes a red urine. That is terminal hematuria in the end. And the other thing is total hematuria. All of the urine stream is red, starting from the urination at the end of the urination. So there's these also have some causes according to the type of hematuria. Like in initial hematuria, the cause is urethra. In terminal hematuria, the cause is bladder, trigor, and prostate. In total hematuria, it can have malignancy, right? As I said, prostate cancer, bladder cancer, or kidney cancer, or stone disease.
Right. We have Rajat Sharma with us, doctor. He's saying, I do see blood in my urine or after urine, and sometimes I feel pains. I am so worried about this, and I want an advice before I go see a doctor.
Yeah, I would say you must consult a urologist or neurosurgeon doctor, because any, as I said, any hematuria episode should be thoroughly investigated, diagnosed, and treated. Yes, you said you have urine in you have blood in urine, and it is also associated with pain. You can have some underlying cause which is leading to this type of your symptoms, and you must go to urologist or neurosurgeon for your this complaint.
Right. Ranjit Singh is asking, though we have already discussed it, but maybe he has joined the session later. So I'm just taking the question. The question is, what underlying problems can cause hematuria?
Yeah, as I said, we commonly see in our practice that is stone disease. It can be anywhere that kidney stone, ureteric stone, bladder stone can cause hematuria. Bladder cancer can cause hematuria. Prostate cancer can cause hematuria. BPH can cause hematuria. Urethritis, that is urethral infection, can cause hematuria. These are common things I'm talking about. There are definitely less common things are also there, but we talk about hematuria, we must first rule out common things, and then we think about less common or rarer things.
Right. Doctor, we have Shubham Maran with us now. He's saying, what may be the reason of red urine? Sometimes I get red urine, then it turns white, and after an hour again it turns red. What may be the cause?
As we said, any hematuria that is red urine should be investigated, and as we also discussed, underlying cause. And as I said, any hematuria must be evaluated whether reports come normal or any underlying, we come to know any underlying cause. And according to this, we must follow the doctor's advice and we go for the treatment. I would also like to say here that some food like ingestion of carrot, some medication can also cause hematuria. So we need to first take history when present with us. So as our teachers used to say, okay, history and examination are the best teacher to guide us. So in today's era, advanced era, I would say we still follow this. We first take history of patient, whether it's what was our diet, what did he take any other things, is easy on taking any medication, like as we said, antiplatelet, anticoagulant medication, any previous history of surgery, whether he is diabetic, hypertensive, and then we go for the exam. So these all things should be kept in mind.
Right, you have explained it so well, doctor. I'll take one more question of A. Raju. What is the safest treatment for BPH?
Safest, I would say, TURP is gold standard, and we commonly do it, and it is the safest, and it is the most oldest treatment, and it is commonly done nowadays also. There are newer techniques in this recent era. It has we call laser treatment, then prosthetic lift, then water vaporization, this enucleation. These all treatments are there, but still the TURP is gold standard, and it can be it is safe also.
Right. Aditya Yadav is saying, why do I have an unusual pain, discomfort, swelling, lump in my genital area? Anything to do with this hematuria?
You said in genital, so first you need to undergo examination by an expert doctor. Where does your swelling is? It is penile swelling, it is testicular swelling, it is lower abdominal swelling, right? And if you have hematuria with clots, you can have bladder clots, which will cause pain as well as hematuria. There is continuous hematuria, and I don't think there is any cause which will cause testicular swelling will cause hematuria. That is very less likely.
Okay, but still you need to go and check with your doctor. That's really important. Akhilesh Sharma is asking, what is microscopic hematuria?
Yeah, as I said, there are two types of hematuria: gross hematuria and microscopic hematuria. Gross hematuria, what we see, what is the color of urine, that is gross hematuria. If we see red color, that is gross hematuria. Right? And the microscopic, as I said, when we go for the investigation of urine, that is urine routine and microscopy, and then the report comes and it suggests that you have RBCs, that is more than 3 RBCs, is labeled as microscopic hematuria in our language. And this microscopic hematuria, even this microscopic hematuria needs to be properly evaluated and further investigated.
Right. You have explained it so well, doctor, that by now at least we understand the importance of going and checking with the doctor if we have these symptoms. And we now know that, it can be due to some underlying cause. So we need to just go and diagnose it. But before we wind up, I would like you to share some takeaway note for us, some takeaway message for our viewers.
I would suggest to everyone that not a single episode of hematuria should be taken lightly. It should consult a doctor, I would say preferably neurosurgeon, and you should undergo investigation necessary, advised by doctor, and according to that, it should be treated. ऐसा नहीं है कि इमेच्योर से डरना है. It is definitely be cured. It is definitely be treated by knowing the underlying cause. And sometimes I'm saying sometimes there we don't find any cause for hematuria, but that is episode is just once or twice, and after knowing that we don't have any underlying cause and it was just due to some medication or due to some ingestion of diet, it was hematuria, then we have sigh of relief.
Right. Thank you so very much, Doctor. It was a very informative session for our viewers, I'm sure. Thank you so very much for taking out your valuable time and enlighten us on this topic.
Thank you very much. Thank you.
It was a pleasure having you. We really look forward for many more such sessions in coming times. Thank you once again. Thank you, viewers, for an excellent participation. For more information on how to diagnose, manage, and treat BPH, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Insta. Thank you. Good day to all of you.